You are a learning organization. As professionals, you are lifelong learners, always growing stronger, taking advantage of new knowledge, in fact, developing new knowledge, always improving your capacity to make an ever greater contribution to the care of your patients. And have you ever come a long way? As usual, in preparation for these remarks, I called upon the nurse I know best, my mother. Class of 1949.
Wow.
She is very proud of her profession and the progress that each generation of nurses keeps making. As a new nurse, back then, my mother's responsibilities included making beds, cleaning bed mats, as well as taking temperatures, changing dressings, and delivering medication. And there were no RPNs for her to work with. On one occasion, one of my mom's nursing friends failed to slice up a grapefruit for a patient. So she was hauled off to the library after work and made to write out 500 times, "I will slice up a grapefruit for my patients." Times have changed. For the better. You know, she told me that back then you had to wear, for some reason, black stockings and black shoes for the first 3 years when you were training. And then you graduated to white stockings and white shoes. And on that very day, they all went to the local bridge, threw those stockings and shoes in the river. Today, you'd probably be arrested for something like that.
They do with their blue scrubs.
Working together, you and I keep pushing out the envelope for new responsibilities for nurses. Just since we formed the government, you can now perform a procedure to detect colorectal cancer, flexible sigmoidoscopy. You can take on responsibility as a surgical first assistant, and you are important players on our long-term care emergency mobile response teams. And then there are Ontario's nurse practitioners. Not only are we creating North America's first nurse practitioner clinics, but we're going to allow our NPs to communicate a diagnosis, order diagnostics, cast a fracture, and prescribe medications. Of course, that is not nearly enough for Doris.
Woo! I like that.
We want you to have a greater say in how we improve care inside our hospitals. Don't get me wrong, doctors are great, but doctors and nurses are better. Here's my point about all this reform. Your profession and my government are relentless reformers. We constantly look for ways to do things better today than we did yesterday, and better tomorrow than we did today. Somebody once said, change is inevitable. Change for the better, well, that's a full-time job. Change is coming to our healthcare system. It has to. Between now and 2030, our seniors population is going to double. That's a fact. Here's another. 60% of our lifetime health costs come after we turn 65.
Wow.
So change is coming. I'm asking for your help to make absolutely certain it's change for the better. Our shared responsibility, as I see it, is to hand over to our children the healthcare system that you and I can be proud of. Getting there won't be easy, and we need to work together to help Ontario families through this change. For example, we need to explain to them. I was first elected 20 years ago. At that time, 32 cents of every government program dollar was spent on health care. Today, it's 46 cents. They tell me if we keep doing everything that we've been doing it, in 12 years, it'll be 70 cents. That means that we would not have enough money for our schools, or supports for our welfare, or enough money for environmental protections, or public transit, or roads. You see, our challenge is not just to leave our kids great health care, but also to leave them the best of all the public services that you and I cherish. Among other things, this means making sure we get the best value for every precious healthcare dollar that we spend. We recently announced that we will no longer pay more than what is fair for our generic drugs. Today, for the most commonly prescribed blood pressure medication on our formulary, Ontarians pay 50 cents a pill. But the Americans are paying 10 cents for the same pill. New Zealanders, 2.4 cents for the same pill. And that's just one of many examples. The fact is we're paying up to 75% more than other places for our generic drugs. It's not right, and of course it's not smart. So we're going to be making some changes. Seniors, families, all Ontarians deserve lower drug costs. You know, there are a lot of working families out there who don't have any kind of a drug benefit plan at all. They're paying out of pocket. This will save them money. As for our government, we will reinvest all our savings in the public drug system and in other areas of health care. This change has generated a bit of controversy. That's helpful in democracy. But I'm confident that we're making the right choices. Since we formed the government, for example, we said yes to more hospitals. We're building 17 new hospitals now, Jay. We said yes to members. We have over 10,000 more. Yes to new practitioner-led clinics. We're going to create 25. Yes to family health teams. We're creating 150. Yes to shorter wait times. But we're saying no. Change to come. That's right. And here's what I want to leave you with. I need your help. We need to change healthcare. Not what we do. That won't change on my watch. I want the best health care for all of us. We need to change how we do it. And I thought of this organization last night. The RNAO Best Practice Guidelines are a perfect example of what I'm talking about. Doris will be proud. Last night, I went online and I read the educational workshop for RNs and RPNs, assessment and management of pressure ulcers. Of 101 slides, only 2 reference pages at the end. But it's very user-friendly and very informative. I'm going to tell you why I read this. I read this particular practice guideline because I can recall I worked as an orderly 35 years ago. And one of the big challenges that we had, myself working with nurses, was to find a way to prevent and treat what we used to call neck sores. And it was a real problem. It was painful for the patients and a source of frustration for those who were involved in delivery of care. So I was fascinated to read your guideline. And had it been around back then, it would have been very helpful. The other reason that I read this guideline is because, and I'm not sure if you're aware of this, earlier yesterday, the OHA, in combination with a few other organizations, put out a report. The report says, among other things, that adopting a best practice guideline for managing skin ulcers can save $9,000 per patient. That by adopting your practice guidelines, we're saving over $50 million every year.
Woo! Let's cheer for that.
Again, this is a perfect example of changing the how. The what will never change. We want to deliver the best possible quality health care to all our families, regardless of their financial circumstances. It's the how that we need to keep looking at. How can we deliver better care? Something that's better for the patient, and it makes our precious healthcare dollars go further. So we need to keep finding new ways to deliver quality of care. This is a big challenge for us. It falls to our generation. This is bigger than me as premier. It's bigger than my government, and frankly, it's bigger than your generation of nurses. This is a big challenge, and it's a wonderful opportunity. It's an opportunity for Ontario nurses, relentless reformers that you are, to play a pivotal role in strengthening our healthcare. Together, let's build a healthcare system that not only meets our needs today, but is also strong enough to meet the needs of our children and grandchildren tomorrow. And I am confident, working together, we're going to get this right. Thank you very much.